Hi, I'm Joanne Matthews. This is assignment 1 for assessment of human performance in its health screening. Okay. So I'm going to look through the different methods of obtaining information for health screening. So we're going to look at health history questionnaire, PARQ, which is physical activity readiness questionnaire, informed consent, and health monitoring tests. So first of all, health history questionnaire, which is a tool for finding an individual's health history. It's an important first step in an individual looking to start some method of exercise. It can cover a whole range of questions. It's very broad. You can get a great deal of information from it, and it can determine risk levels for the individual. So the strength and weakness of the health history questionnaire, it's a structured formal document, so it's typed up and it's there for the individual to go through and put as much information as possible down. It's incredibly informative. Like I say, it covers a broad range of subjects. It's a wide scope of questioning, and it can be adaptable, so you could put different information to suit different forms of exercise and different kinds of information that you want to get from the individual. In terms of weaknesses, the information could be changeable, so you could get a client come into a gym or to start some exercising, and they complete the form to the best of their knowledge then, but for whatever reason that information may change. Someone's health might change, or different things may have happened to them in the period of filling the form in to them later on. It doesn't actually give any consent, so it doesn't give any agreement to do anything or an understanding of what's going to happen going forward. And you maybe have to question the validity of the information. If you have a client who's really keen to exercise, may withhold some information that would potentially stop them from exercising. So it's obviously very trust-based. So the PARQ, which was developed by the Canadian Society for Exercise Physiology and Health. It's an initial screening tool, a very specific initial screening tool, used for people aged 15 to 69 years of age. It's administered before clients start any physical activity. It's standardised at 7 questions, very much around heart health, serious risks that have happened in the past relating to your heart. So it needs to be done before any exercise programme is commenced. If the PARQ is completed and a client does answer yes to a question, they would need to see their own GP before any moving forward of any further exercise. It covers known diseases and signs and symptoms, and as I said, if they answer yes to one or more of the questions, then medical advice must be sought. So the strengths and weaknesses of the PARQ. Once again, like the health history questionnaire, it is a structured formal document. It is standardised, the 7 questions are always standard, and it is informative in that specific range of questions. But in terms of weaknesses, it only provides limited information. It is only 7 questions, so it doesn't have the scope of the health history questionnaire, and it's only a high level of health that it's questioning. It doesn't go to lower detail. Once again, as the health history questionnaire does, it doesn't find out about lifestyle, it's just specific medical and health issues. Informed consent. So this is obtained from participants before exercise in a health and fitness environment. It's an ethical and a legal consideration. The purpose of it is to ensure that the client does know what's going to be happening and what they will be doing going forward and any risks associated with that. Generally, the form should be run through with a professional and the individual, so they know exactly and they can cover all the questions and they have a full understanding of what they are actually signing and consenting to. It also should include that the client themselves, the individual, has been given the opportunity to ask any questions about the programme. They are actually signing to say this, that they've been given the opportunity to gather any further information that may be needed. It'll include information to say that they are free to stop at any time, they're under no legal obligation to continue. If the participant is a minor, then a legal guardian must sign the document. So strengths and weaknesses of informed consent. So it's a structured formal document again. It is very clear and concise in terms of the agreement and the consent that's done. It's defining responsibility on both behalves, and it's agreed by the required people that need to be involved. But in terms of weaknesses, it provides no health background or information. It's just an agreement to proceed with an exercise, a structured exercise programme. And it has no input to health or fitness levels, so you're not going to gather any of that information from them. It's merely just an approval to move forward, and that they have an understanding of what's going to happen in the exercise programme. Okay, so health monitoring tests. We're going to look at blood pressure, lung capacity, also known as peak flow, resting heart rate, and hip to waist ratio. Okay, so blood pressure. Blood pressure, it's necessary in order for blood to flow around the body. It's a clear and simple indication of health. And the pressure, it's a result of the heart contracting and forcing blood into the blood vessels to pump around the body. So two values are given when the blood pressure is taken. One is systolic, so this is when the heart is contracting, and the other is diastolic, is when the heart is relaxed. So it's calculated by using an electronic device. A reading can be taken with a blood pressure meter and a stethoscope. I'm going to talk about using an electronic device here. So the electronic device uses an automated reading, so a cuff's placed around the arm in the correct position with the cabling flowing down the front of the arm, and the individual would rest their arm onto a surface. There is a button to press start, and it would then automatically take, the cuff it must be placed on the upper arm over the artery and to ensure that the client can still actually bend their elbow. Then when they're in that suitable, comfortable position and the cuff's in the correct location, you press the button and it will automatically take the reading, and then the display will be showing what the final reading is at. So all adults should have blood pressure below 120/80. That's the ideal pressure for people who are wishing to be in good health. Readings of 121 to 139 systolic or 81 to 89 diastolic are considered as pre-hypertension. So it's a warning that potential blood pressure issues may arise and become to dangerous levels. The higher the blood pressure, the increased risk of heart disease, kidney failure and other blood vessel disorders. So the strengths and weaknesses of blood pressure testing. In terms of using the electronic device which I've just spoke about, there's no room for incorrect data. Certainly if you were to take the reading more than once, ideally 3 times, it's a reliable and valid, it's a device that's taking it. The weaknesses, other factors can actually affect the blood pressure, external factors, like the emotional state of the person, what has been eaten and drank, if they've exercised and they've not rested sufficiently, ideally they should rest sufficiently before it, and any medication could also have an effect on that reading. Okay, so lung capacity, also known as peak flow. So this is used to determine the airways between the mouth and the lungs, and that they're clear and conducive to good airflow. So poor lung function limits oxygen that can be delivered to the bloodstream and tissues. It's measured using a microspirometer or a handheld peak flow. So the example I've given here of how to take a peak flow reading. So the individual ideally should be in a standing position with the peak flow directly in front of their mouth. They need to take a deep breath in and then blow sharply onto the device, making sure that they've got a good lip seal for maximum blowout. And they need to ensure that the fingers aren't over the reading, because you can actually limit the where the reading is taken from. The procedure to be repeated 3 times, and the highest reading should be then taken. And then the actual final reading is the peak flow rate. And here I've got some normative data listed. strengths and weaknesses of peak flow, which is the slide I've missed. It's a simple and portable reading to take. It can be done quite simply. It would be cheap in terms of the consumable side because it's just replacing the cardboard end. It's in terms of disadvantages or weaknesses, it does require effort from the individual. So, and they've got to get the technique completely right to get the most accurate reading. So you are relying on the individual to put input into getting the correct reading. So resting heart rate. So it's a simple and effective way to ensure, to check how the heart muscle is functioning. It can be measured manually or using a heart rate monitor. The best time to take it is first thing on the morning before the person gets out of bed and before they encounter anything in the day, any exercise or movement or work or anything. So to calculate it manually, the client must sit and rest for approximately 5 minutes before the reading is taken. And then throughout the reading, it must stress that they must sit still and quiet for the whole time. So they need to locate their radial pulse, which is in the wrist, or the brachial pulse, which can be in the front of the elbow. Ideally, the wrist one is the most simple to access. So the individual taking the reading places their middle and index fingers on the pulse. It should be the pulsing that you can feel should be counted for 60 seconds, and that gets the heart rate reading. So there's some resting heart rate. Obviously, it's determined by age, and then it's categorised from poor to athletes. So the strengths and weaknesses of heart rate testing. So providing the conditions are correct and your client is sat and is rested correctly beforehand, it is a simple and reliable test. There is no equipment needed, just manual, and you can take the reading yourself without anything at all. The weaknesses, it once again could give an untrue reading depending on the person's pardon me, emotional state, anything that they've eaten or drank, or how they're feeling at that time, or if they've not rested adequately, then the reading wouldn't be accurate. And once again, medication could also have an effect on somebody's resting heart rate. So now we've got the hip to waist ratio. So this is an indicator of health risk associated with obesity, and in particular coronary heart disease. So it's because fat stored in the abdominal area is regarded as an incredible risk, as it's closer to the heart and to other critical internal organs. So this is calculated by using a tape measure. Just a tape measure is needed. It's taken around the stomach, around the navel, muscles relaxed and following just a normal breathing rate with the client standing up. And then the tape is taken around the waist and the horizontal reading is taken. And a measurement is taken with the client standing at the widest part around their hips, usually taken at the level of the trochanter and of the femur, so it's around the thigh. The ratio is worked out by dividing the waist measurement by the hip measurement. For example, a 26-inch waist and a 30-inch hips would be 26 divided by 30. So the hip to waist ratio normative data. So a male with anything regarded 1.0 as high risk, and a female 0.85 is regarded as high risk. So the strengths and weaknesses of this form of testing. It is quick and simple, no expensive equipment, it's only a tape measure that would be required. But in terms of weaknesses, it doesn't actually take into account the actual type of body mass. So you could get somebody who has a low body fat reading and is just has a lean muscle mass. It doesn't look at any of that, it's just the external reading. So high reading would therefore be misleading. So now this is my two questionnaires. So this is person A. So briefly, this is a 58-year-old female. She has what you would regard maybe as a good level of fitness. She plays badminton regularly, which is her sport, and she participates in walking. So I went through the form with her and discussed it, and she gave me feedback around each of the questions as well. And then person B is a 38-year-old male who plays football twice a week and also does strength training, a fair amount of strength training. So to compare and contrast, so looking at their height and their weight, we've got person A is 5'4" and she's 9 stone 9. Person B is 6 foot and 87.3 kilograms. So to look at these, I've actually looked at it in relation to BMI. So person A is within a healthy range, but person B is regarded as unhealthy, using a BMI calculator, which suggests it demonstrates to me the inaccuracy of a BMI reading, because person B has a very low body fat and has very lean muscle mass and is a fit person. So the 7 PARQ questions, they were both no to all, so they'll both be able to continue with some exercise. Medication, person B was no, but person A is takes yes, said yes, and she takes a low dose of a blood pressure tablet. But it's recommended that physical activity can help reduce the risk of heart disease and assist with weight management and blood pressure. And she's actually actively encouraged by her doctor to continue exercising, because it's only a positive thing in relation to her blood pressure. Person A, there is a heart disease in the family history. Father has had problems, person B is no. But person A stressed the reason for her exercise is to keep her heart healthy, once again encouraged by a doctor, because it's only good for heart health. The question, do you drink alcohol? Both A and B answered yes, 0 to 3 units per week. That is within the recommended 14 units per week, so both fine on that account. Sleep habits, person A doesn't regard herself as a good sleeper, but person B does. Person A has kind of a stressful life, some family issues that she has going on, but once again, the Sleep Council, source from online, advises that exercise does go towards good sleep. So once again, another reason for exercising. Stress levels, person A high, person B is moderate. Another reason for exercising, proven that exercise reduces stress and encourages well-being. And question number 9, participation in regular exercise. Both yes, and both meet and go over and above the ACSM guidelines of moderate intensity exercise for a minimum of 30 minutes, 5 days a week. And now my references.
Okay, well done, Joe. If you just go back a slide, I don't normally ask questions on this, but your medication, I think, question 9, you've put that person A has a low dose in blood pressure.
Yeah.
However, they ticked no to a question on the PARQ. Isn't a question on the PARQ associated to blood pressure?
She didn't, because she regards it, it's like a 0 point something measurement that she takes.
Mm-hmm.
So she regarded the PARQ as more of a serious thing. She did look at it at the time. It's incredibly low, and she's only been on it for a short period of time. So that's why it's no and yes kind of thing.
Okay. No worries. Thank you very much.
Okay.